Dr. Michael Helgeson, co-founder and CEO of Appletree Dental. Appletree is a non-profit critical access dental provider, and since 1985 we've been working to provide affordable dental care for people who need it most. Our highly skilled dentists and our team approach have allowed us to expand to serving children, elders, and patients with special needs. We have 8 centers for dental health around the state of Minnesota, and we also bring mobile services and our teams directly to nursing homes, Head Start centers, schools, and medical primary care settings. With the help of public, private, and nonprofit donors, Appletree has been able to design and build state-of-the-art centers for dental health, which have innovations such as hovering dental chairs, ceiling lifts, IV sedation suites for people with complex medical, behavioral, and dental needs, and 3D cone beam imaging. We have also helped community leaders replicate our model in Minnesota and in states across the country. In response to the COVID-19 pandemic, Appletree has added bipolar ionization to our HVAC systems and extra oral dental suction machines in our treatment rooms, and we've provided extensive infection control training. All these measures help keep our patients and staff safe. Our mission is to overcome barriers to oral health, and our vision is to inspire partnerships that foster healthy communities. I want to thank everyone for your support. Welcome to the grand opening of the Fergus Falls Center for Dental Health. In the next 30 minutes, you'll be hearing messages from state, local, and community leaders, seeing a ribbon cutting, and going through a virtual tour of the new Fergus Falls Center for Dental Health. It's a public nonprofit partnership. Together, we've successfully closed funding gaps by combining public, nonprofit, and private resources. 2 critical access dental practices are now under one roof, and together we've created a new team with special care expertise that will extend care throughout the region. DHS and Appletree have created a welcoming dental home for patients of all ages, ethnicities, and abilities in the region, a safe, supportive, and attractive work environment, and a model dental access solution in rural Minnesota. We're just getting started. Soon we'll launch a joint IV sedation program for people with disabilities. And we plan to build a new garage so we can expand our mobile and telehealth services. And we're already planning for the launch of the first rural dental residency program in Minnesota. None of this would have been possible without tremendous leadership from the Department of Human Services, from Marshall Smith and Shirley Jacobson to Jared Grupner, Dr. Kayeski, and Trish. Everyone went above and beyond. Likewise, the team at Appletree stepped up to the plate. From our board of directors to Suzanne Peterson and Dr. Greppity at the Fergus Falls Center, to Nancy Schumacher and Karen Engstrom, Mary Larkin, and the rest of our team, everyone stepped up to make this project a success. The community played key roles to make this project possible. From Diane Thorson, Eric Snyder, Thad Olson, the entire city, the local community, including all the local dentists, stepped up and helped in every way they could to make this project a success. But projects like this don't happen without major donors, including Delta Dental of Minnesota Foundation, the Frank Vidine Charitable Trust, the Otto Bremer Trust, Blue Cross Blue Shield of Minnesota, and Prime West Health. Building a new building is a huge undertaking, and the designers and builders from Primus Dental worked tirelessly to create such a beautiful center. And they were supported by the very best local contractors from throughout the area who did beautiful work from the foundation to the roof. Kevin and Kenton from Patterson Dental provided outstanding help throughout the project and worked very closely with dental equipment experts from ADEC. A big thank you to everyone who helped make today's celebration possible.
Hi everyone, my name is Ben Shire. I'm the mayor of Fergus Falls, and I'm incredibly excited for the grand opening of the Apple Tree Dental Care Center in Fergus Falls.
Lack of dental care is a serious problem faced by 1.2 million Minnesota children and adults every year. People with physical and intellectual disabilities or mental illness face barriers that go beyond financial. That is why this new Center for Dental Care in Fergus Falls is so important.
I know the importance of dental care for kids. I have 5 kids myself, and I know when there's dental problems, they're not able to perform in school, they're not able to perform in life.
Hey, I'm Diane Thorson. I am the retired public health director from Otter Tail County, and I'm here today to talk a little bit about our journey to address dental access issues.
At the health department, we're committed to working to bring about health equity, and we recognize that health disparities are most stark in oral health, in both the ability of people to access care and in the health outcomes that people live with. We're constantly working to address the fact that practically the entire state of Minnesota is a dental professional shortage region, and that includes Otter Tail County.
We know, and Dr. Helgeson and his team know, that oral health is integral to overall health, and that there are people that go without oral health care because of not having coverage or not having access to a dentist, not having access to a dental home or a regular dentist that you go to over the year, and also for patients with special needs. A lot of dental clinics and a lot of dentists are great dentists, great clinics, but they don't have the experience or the skill set to deal with patients with special needs. And we believe that everyone in Minnesota is entitled to good quality dental care, and Apple Tree provides that.
My co-trustees and I have become very interested in the state of our public dental health here in Minnesota, primarily because of Frank Vadim. He went to the University of Minnesota Dental School, and then he spent 47 years in dental practice in Fergus Falls. It's been an eye-opener for my co-trustees and I to get to understand the barriers that many people in our society today have in getting adequate dental care.
It was clear that Fergus Falls was in need of a truly transformative solution, and to see the community efforts of multiple organizations, public and private, working together to meet this need was truly something that we felt we needed to be a part of.
Apple Tree and DHS complement each other well. And by sharing a location and certain services, we will both be able to do more.
Hi, I'm Jody Leon. I'm the current Public Health Director for Otter Tail County. We're always looking to get the right service at the right time. And unfortunately, when we don't have good access to dental care, we see clients and people in the community accessing other healthcare, such as emergency rooms, for necessary dental care. By having something like Apple Tree Dental in our backyard, in our region, to access those needs, we're using the right service at the right time for ultimate health care.
Our Rural Health Advisory Committee focused on oral health in their 2018 report on strengthening the oral health system in Minnesota, in rural Minnesota, and continues to call for payment reform to increase access, for expanding and maximizing the oral health workforce, and for staying open to developing new models of oral health delivery.
Well, over the last 10 years, the Delta Dental Minnesota Foundation has made contributions in excess of $40 million throughout the state of Minnesota, both in the metro area and in greater Minnesota. In talking to Dr. Helgeson and other representatives at Apple Tree, we learned that the former clinic in Fergus Falls was in need of an upgrade. And we liked the alignment that Appletree had established with community members, with community leaders, with practicing dentists, with the state of Minnesota, and we thought that was an important venture, an important effort to support financially.
The Otto Bremer Trust has long been committed to our work in critical access care, and Appletree's focus on kind of the holistic model really matches with something that's been very important to our organization for a long, long time. Health and wellness were important to our founder, and they're important in our current organization.
The Vadine Charitable Trust has been making investments in public dental health in West Central Minnesota. We've been particularly interested in the Early Childhood Dental Network, which provides education and resources to help people better understand good dental hygiene.
I'm incredibly impressed and excited at the technology that this center will employ to provide care for the patients in this community, and more than double the patients' capacity. That's great for our community. Again, it's a great vision and it's a great partnership.
Appletree Dental is a nationally recognized pioneer in providing special care for low-income and underserved populations. And more patients throughout West Central Minnesota will receive the care they need in this fabulous new facility.
Under Dr. Helgeson's leadership, Appletree has shown an unwavering commitment to breaking down barriers to accessing affordable, high-quality dental care. The care delivered by its team is culturally competent, compassionate, and grounded in clinical excellence. And I would be remiss if I didn't acknowledge the role that Appletree continues to play in innovating in the workforce space. Appletree was one of the early adopters and big supporters of dental therapists in Minnesota. We and the dental community as a whole are grateful for the clinical education experiences that Appletree continues to provide to aspiring dental therapists.
When there's not one funder, but there's a team of people, a team of interested people from different segments or maybe different geographies, and might be supporting it for different reasons, but that Appletree can pull all those funders together, both public and private funders, to extend dental care to people in need, people underserved, and then people with special needs as well.
And Appletree has had, as I understand, more than 1,000 people on its waiting list. And how marvelous that they're going to be able to provide for the dental needs of more of the people of West Central Minnesota. And I am so excited about how Appletree has worked together with the state of Minnesota with such an innovative idea of combining a facility, sharing resources to provide better public dental health to the region around Fergus Falls and West Central Minnesota.
The Appletree model is truly sets the highest bar for work in critical access dental care. And we've been working with Appletree for over 20 years. And now, having seen the center and the increase by thousands in the number of visits that can be handled, we are so pleased to be part of it.
On behalf of all of the citizens of Fergus Falls, to say thank you, Dr. Helgeson, and your entire Appletree Dental team for partnering with the city of Fergus Falls to provide these important and incredibly valuable resources to our citizens. Thank you.
The Center for Dental Health would not be possible today if not for the innovative partnership between Appletree and DHS, the generosity of 3 incredibly civic-minded foundations and trusts, and the foresight of city and county leaders. And it's my hope that the Center for Dental Health can be a model for many others to follow. To everyone who had a role in this project, thank you. Your work will improve lives for decades to come, and DHS is proud to be a part of it. Thank you.
From Otter Tail County Public Health, as well as the Partnership for Community Health Board, we want to congratulate Appletree Dental on the success of the building that they brought to our community to service those in need of dental services.
I speak on behalf of the Commissioner of Health, and acknowledging the tremendous work of many and many behind the scenes to make this partnership a reality. To Appletree, congratulations on your new venture. Your legacy of service and commitment to your community continues, and for that, we thank you.
So congratulations to Appletree and the state of Minnesota, and to all those who have been so involved and concerned about providing better dental health in West Central Minnesota.
From everyone at Delta Dental and Minnesota Foundation to Dr. Helgeson and everyone on the team at Appletree, congratulations on the new clinic, and we look forward to visiting you in Fergus Falls soon.
Best wishes for our future together, and better health and wellness for every member of the community.
On behalf of the Board of Directors of Appletree Dental, I want to congratulate everybody that's been involved in this project. You've all worked hard and diligently to bring this dream to fruition. Congratulations.
We're all coming together, so let's have a big cheer and let's cut this ribbon. All right. Yeah. All right.
Hello, I'm Dr. Michael Helgeson, the Chief Executive Officer of Appletree Dental, and it's a great pleasure to welcome you to this virtual tour of the new Fergus Falls Center for Dental Health. This beautiful new center is the newest and most advanced of all of Appletree's 8 centers in Minnesota, and it was made possible by generous donations from the Delta Dental Foundation, the Frank Bedeen Charitable Trust, the Otto Bremer Trust, and other major donors and other key stakeholders in the Fergus Falls community. This is just a terrific story of this community coming together and providing the resources to make access to dental care possible for thousands of people in Fergus Falls and in the surrounding area. I hope you enjoyed the tour today.
Hi, my name is Suzanne Peterson. I'm the Center Director of Appletree Dental here in Fergus Falls. As you can see, we are in a beautiful facility. We're able to move from a 6-operatory facility at our previous location into this beautiful 12-operatory clinic here. And we also have a surgery center and a recovery room, so we will be able to start taking patients off of our waiting list. We have over 1,200 families on our waiting list, so we are anxious to start taking people off that list and be able to share this beautiful building that we have with all of those people that need a dental home.
Working in the new clinic has just been amazing to see all the patients come in and their awe and just the majestic of the surroundings from coming from the mall in such a tiny space to this grand building, and their comments have just been wonderful, and the space is just amazing.
Hi, I'm Brittany, and I am a dental hygienist at Appletree Dental. And right now I'm in the patient toothbrushing area, which is located right off of the reception area. And it's really nice to have this here because the patient can come in for their appointment, and if they haven't had a chance to brush their teeth after lunch or for whatever reason, they can do that before their appointment. Another great benefit of having this is we can bring them from our chair if we're doing some detailed oral hygiene instructions. We can have them pretend they're, in their home atmosphere instead of sitting in the chair with no sink, not a lot of water, anything to rinse with. So they can come right in here and we can give them detailed instructions just as if they were at home. We're excited to have it. It's working really, really nice.
Hi, this is Katie Molter. I'm a clinic care coordinator at Appletree Dental. In our nav rooms, we are able to have private, personal conversations with our patients, whether it's regarding their treatment that they need, their account balances, going over other payable services that they need to have done. Not only do we do wonderful services in this clinic, we also are able to do some outreach programs. We're able to go to a few of our local schools and do some screening. We're also able to go and do cleanings, checkups, x-rays and all of that. And sometimes we do get to get back there and do the restorative work that is required. I get to do all of that scheduling. It's a very good opportunity for our patients that are not able to come to our clinic.
Hi, this is Dr. Gorepati. I'm one of the dentists at Fergus Falls Appletree Dental, and this is one of our treatment areas, and we have like 4 treatment areas grouped as a quad, and dentist works in one of the operatory, and we have a dental therapist working in a different one, and we have a hygiene working in a different operatory. So we work as a team to provide the best possible treatment for the patient. This treatment room is equipped with a navigation area where we can talk to the patient. Instead of the patient being in the chair, they can come and sit on this mini sofa and they can talk to the dentist, and we can show them all their electronic health records, and we can pull up their x-rays and show up like what findings we saw on those x-rays, and we can discuss the treatment plans. And it will be more engaging for the patients too, and it will provide them with an opportunity to ask any questions that they have. And our patients have been appreciating this thing a lot. So a couple of our treatment rooms are equipped with the patient lift, where you can raise the patient from their chair and put in the dental chair instead of having them to struggle to get into the chair. And one of my patients, she had a condition where she cannot lean all the way back and cannot get out of the chair. So when I did extractions and fillings on her, I used to literally sit on the floor like this and do the extraction. Even with the fillings, I had to be on the floor, bending all the way down to do it. But with the new lift, we can raise the patient and put her in the chair. That way both I'm comfortable and my back doesn't hurt, and the patients are comfortable as well.
My name's Elise Rogholt, and I am the Dental Assistant Supervisor here in Fergus Falls. With our new sterilization area, we've really been able to have quite an improvement to what we were having before. We have all the bells and whistles here, starting when we bring in our dirty instruments. We have these hands-free touches where we can activate a dirty section where we can store our instruments. But with the SciCan instrument washers, we're able to really make sure all the debris is getting off of the instruments and getting them prepped to be as sterile and as clean as possible. We have hospital-grade Lexa sterilizers. This allows us to process twice as many instruments in a single hour. We have the easy touch cabinets where they're able to open and close very easily. So when we're taking instruments out, we're able to minimize the amount of contact that is coming in with them and keep them in a sterile area. And so we're able to keep all of our cassettes that we have here organized very easily, so the girls can come in quickly, find the cassette that they need, and have all of the instruments and supplies needed.
Hi, my name is Neil Irian, and I'm a dental therapist with Appletree Dental. A lot of people still aren't familiar with the term dental therapist, but essentially we're mid-level providers in dentistry. We're a lot like a nurse practitioner or a PA of the dental world. Some people might be surprised that dental therapists, the training that we get is very similar to that of a dentist. We essentially do the first 2 years of dental schooling before we are able to practice. It's amazing. I'm just going to go right over your nose, just like an astronaut or a fighter pilot. You're one of the Blue Angels. At Appletree, I've had a lot of really neat opportunities to do some cutting-edge things. I'm one of the first people to be able to do teledentistry, taking pictures of teeth and then remoting those back to a dentist who was able to do the exam. Did a lot of satellite work at Head Start programs, at migrant schools, and even at nursing homes in the Fargo-Moorhead area, where I was able to do cleanings and even screenings, going to the residents in their rooms and checking their teeth find out if there was any urgent needs, and then referring them to the dentist, or even having Appletree bring their portable equipment to the nursing home to be able to provide for those needs right there in the nursing home setting.
I'd like to welcome you to our special care dentistry clinic in Fergus Falls. My name is Trish McClellan and I am the clinic manager. I can't tell you how excited we are and so grateful to be in this brand new facility with Appletree Dental. What has been the most rewarding for us personally is to see our patients come in the door with a handicapped accessible and with the smiles on their faces that they're just in awe of this beautiful new building.
Hi, I'm Connie, and I'm a licensed and certified dental assistant for the state of Minnesota. And I am so excited to be in this wonderful building with Appletree. Coming from a place where there was no accessibility for wheelchairs to a place where we can have so much room and extra space just to have our patients sit and be comfortable and do our work and laugh and have air and window space to do our work and have fun.
My name is Dr. Phil Meyer, and I'm a dentist here at the Minnesota Special Care Dentistry Clinic in Fergus Falls. And it's a beautiful new clinic. From where we came from, it's a huge advance. There's lots of room with the handicap accessibility. I'm just really excited to be partnered with Appletree because our missions are the same, to overcome barriers to oral health. And the patients that we treat at this special care clinic have many physical and developmental barriers to health. It's very difficult to treat them in private practice. It's very exciting for us to be able to be here and to take advantage of this beautiful facility. Even on the most difficult days, just looking at their faces and looking at the faces of their parents and their guardians and those people who love them and care for them, and to be able to help when they haven't had any access to care for their entire lives is so gratifying. So even on the most difficult days, I just keep my eyes on the faces of the patients and the parents that bring them here, and it's very, very gratifying to do this kind of dental work.
Hello, welcome. My name is Jerry Grutner. I am the Executive Director for Direct Care and Treatment Ambulatory Services. It includes our dental clinics that we have around the state. I want to welcome you to our IV sedation dentistry facilities here. Just a little bit about Direct Care and Treatment. You probably already heard Direct Care and Treatment as a part of the Department of Human Services. It's a partner with Appletree Dental. We're really excited that we're able to partner in this facility, state-of-the-art facility actually, for care of folks with special care needs in dentistry. And just so you know the background, that we have 5 of the clinics around the state, we have for several years, provide services to individuals with developmental disabilities and also severe and persistent mental illness and traumatic brain injury. This is for us a brand new adventure and a brand new opportunity for us. We have wanted to add IV sedation as a service for several years. Right now, several of our patients require actual treatment within a hospital, full operations room, and they're under full anesthesia. In this case, we will be able to provide services to them through IV sedation. And that is going to be a much more efficient, effective, and safer procedure for many of our patients. This is the first of our clinics that we're adding that to, so we're beginning it about the first of this year. Dr. Helgeson, anything you'd like to say about the facility as well? Yeah, and again, thanks so much. It's just so exciting to share this kind of capability. This is going to be a very complex, very advanced capability, working with anesthesiologists, nurse anesthetists, and for us to team up and share this costly infrastructure and team up clinically and be able to provide really the optimal care for patients and bring these services up into northwestern Minnesota. And we're hoping to launch this the first part of 2021. So we're real excited, and thanks for coming for the tour. Thank you very much.